Rural healthcare faces huge challenges like staff shortages, a lack of services and specialists. But thanks to technology, the face of rural health is changing. 3 News Now investigative reporter Jeff Van Sant has the story.
Ooh, good tackle. Good play. Oh, ouch.
Dr. Brandon Essink is watching his son's football game.
He's a small guy, but they put him at nose guard because he's quick.
While he cheers him on, he's actually working on duty as a telehealth physician.
But it's great being able to be out here and you know, even if I get called now and I miss 20, 30 minutes of the game, it's like I can still get back out and watch the kids.
Connected to several rural hospitals, sometimes in different states. From a text or a video call, he's an extra hand.
That's really why I wanted to keep doing it, because I could still keep practicing rural medicine, and but I also wanted to help prevent burnout, because I got burned out doing it.
He worked in rural medicine for years. Now his office is home with his family.
What kind of math? Fractions? My kids were getting into the age of having more activities, and so those activities were starting to be missed by me more, and I wasn't liking that.
The system is impressive.
But I can move the camera around, I can zoom in right onto their face.
Dr. Essink has a 360-degree view of the hospital room. Can talk to patients, nurses, doctors.
Specifically zoom right in there, and you can see that fracture of this finger.
It's like he's there.
They'll tell us, I forgot that you weren't standing here in the room with me.
Connecting rural patients with specialists hours away, even in other states.
When I go someplace, I like the fact that I know so many people.
Carol Case lives in Lexington. 2 years ago, she had a health scare.
Found out I was a diabetic and I had an infection in my foot. And as a result, I lost about half of my left foot.
Specialists that she needs aren't close.
There were weeks I might have 4 medical appointments in 1 week. And if I would have had to travel out of town for each one of those, probably would have had to make choices on what I was going to focus on.
Telehealth comes in, allowing Carol to stay near home. The American Hospital Association says in 2010, 35% of hospitals used telehealth. By 2017, it's jumped to 76%.
This is definitely the future of medicine.
Dr. Essink can examine everything from a common cold, a stab wound, to adjusting medications.
Because otherwise we can maybe give her some hydralazine or something. Okay.
Okay,
thanks.
thank you.
Bye.
Building rapport with patients, he's even brought in another specialist.
Yeah, he's probably lurking around. He's kind of a big chicken.
Lucky, the cat. Patients love him.
But the cat can look in the camera and do all those things, and they're completely distracted.
Dr. Essink is licensed in Nebraska and several other states. So he could have a patient in a place like Georgia, and he's not stuck in his office.
So as long as the patient's there, I could be in Brazil, I could be in, Europe, I could be anywhere.
It's a field that is changing the face of rural health, where specialists are limited, sometimes non-existent. And it's getting better every year. So good, one day your surgeon might not even be in the room.
I think eventually you'll get to the point where you'll have a surgeon consult from their home, and they'll do your surgery remotely. And I don't think that that's Jetsons, 100 years away. I think that's within the next 5 years. You're going to see cases of that happening.
Jeff Van Sant, 3 News Now.
You can watch all of the investigative team stories on rural health care on our website, 3 News Now. And if you have a great investigative idea for our team, email us at investigate@3newsnow.com.